Our topic this session is depression and sleep. Thank you for joining us, Dr. Gurley.
Thank you, Dr. Brayman.
So depression is quite common and, well, just very depressing. What is the relationship between depression and sleep, and how might we use sleep to prevent or treat depression?
Well, there is definitely a strong relationship between sleep and depression. Several studies have found that not enough sleep and difficulty sleeping, which is called insomnia, increases one's risk for developing depression. And it's not fully understood why poor sleep increases depression, but there's a lot of evidence that poor sleep makes us more sensitive to stress, and stress over time can cause depression. So one study that followed people for 8 years found that people who regularly have trouble falling asleep or staying asleep were between 2 times and 5 times more likely to develop depression during that 8-year period that they followed them.
Wow, that's actually huge. That's 200% to 500% increased risk. Given that a person with insomnia wants to get good sleep but just can't sleep, what can a person with chronic insomnia do to avoid this big increased risk for depression?
Well, one treatment for insomnia that has been found to be quite effective in many people is called cognitive behavioral therapy, or its abbreviation is CBT. And basically, CBT helps people learn how their beliefs and behaviors are disrupting their sleep, and then how to develop new sleep habits and attitudes that support healthy, restful sleep. There are even some CBT programs now that are online, so it can be a very convenient way to address your insomnia.
CBT is a powerful lifestyle tool for overcoming insomnia and reducing one's risk for depression. I had a psychiatrist colleague just recently share with me that the VA healthcare system has actually developed an app called CBTI Coach. And he was telling me that it basically does what he would do working with a person through many sessions, except it's on an app and it's a lot more convenient. So I'm having a couple patients try this out and give me some feedback.
That's great. And yes, this CBT is not only shown to help people overcome chronic insomnia, but other studies have found that cognitive behavior therapy for the treatment of depression is as effective for treating mild, moderate, and even severe depressive disorder as is the most widely used antidepressant medications. And the risk for side effects from CBT are much, much lower.
Wow, as effective as antidepressant medications, that's very impressive. And it sounds like the side effects are pretty similar to other lifestyle medicine treatments. Basically, they're all positive. This is the kind of medicine that should be our primary treatment for most of the ills of modern life. Treating the cause is the best treatment. Thank you, Dr. Gurley.
Thank you, Dr. Brayman.